More than 7 out of 10 adults in New Zealand support bringing dental care into public health system, according to a new poll commissioned by the Union for Senior Doctors and Dentists and released today on World Oral Health Day. A group called Dental for All, comprising anti-poverty groups such as Auckland Action Against Poverty and practicing dentists, are now calling for the politicians to bring universal dental care into the public healthcare system. Brooke Stanley-Paul from Auckland Action Against Poverty and spokesperson for Dental for All joins us now. Brooke, ngā mihi nui kia koe, welcome to the program. Obviously, the costs to go to the dentist is a huge barrier for most. Do we know how many, exactly how many people delay visiting the dentist because of the cost?
Yeah, according to the poll that we have, around 72% of people delay going to see the dentist, and that's because cost is a huge barrier.
And how are oral health inequities impacting whānau Māori?
We believe that they contribute to the high rates of heart disease that currently exist within Māori communities. Our mouth health is also deeply connected to the rest of our physical well-being. And so, yeah, this is huge. It's a huge, it's just, yeah.
We know that Māori have been disadvantaged by the current oral health system. How could free dental care help turn this around?
Yeah, I mean, removing the cost is what we're asking for. It could be transformational for the communities, and Māori communities especially, but other communities as well, who put off going to see the dentist. Another statistic within the poll was that 43% of people had visited a dentist in the last 12 months, and within the communities that we work with at Auckland Action Against Poverty, we believe that these stats actually could be much higher. So, as I mentioned before, this would be incredible.
You mentioned earlier that dental health care is connected to other health issues. What do you mean by that in terms of the well-being of people?
Yeah, so just in terms of, I'm not sure if we're aware, but bacteria from our mouth can get into our bloodstream and travel into other parts of our body, which can cause inflammation. So it's actually really connected to our heart health. There's also a lot of shame and stigma associated with dental care, for people that don't have their teeth or can't afford to go and see a dentist as well. There are a lot of social impacts that are connected to poor dental health outcomes in Aotearoa.
What do you think successive governments have not brought dental into the public healthcare system?
I mean, I think that's pretty obvious. I think the government is a house that protects businesses and wealth. And I guess what we're calling for and asking the public to get behind us is that we should be prioritising the health and well-being of our communities at every level. And this is but a small part that people can play. That's extremely important in ensuring that there's pastoral care, but also preventative measures for our communities to keep them healthy and well.
So what are you hoping from the government and how are you lobbying the government for change?
Yeah, so we're hoping that they will, provide free dental access for everyone in similar ways that they do for children. The campaign will continue to work together throughout this year, and given an election year, we're hoping that there are political parties that pick this up. This is a very popular policy with people on the ground. And so, yeah, our ultimate goal would be that there's dental for all.
Hapai. Well, we'll be keeping a close eye on how the campaign progresses. Brooke Stanley-Paul from Auckland Action Against Poverty and spokesperson for Dental for All. Thank you very much for your time today. We appreciate it.
Thank you.